This is the exam time. The DM final exams of major institutes are getting over one by one. Today I will show you the theory questions of final exams of Aims Rishikesh. This is paper 1. The questions are: describe the bicarbonate handling by the kidneys, inhibitors of stone formation. Another repeat question. The difference between osmoregulation and the cell volume regulation. Diagnosis and management of SAIDH. Another important question from the initial part of the HALI. Pathophysiology of hypertension in CKD. Urine microscopy. It is not regarding the interpretation, it is regarding the preparation. So be careful with the question. Indication and contraindication of biopsy. Another easy question. Different stains used in light microscopy. Markers of tubular damage. Mineralocorticoid excess state. Magnesium homeostasis. Another important question from the initial parts of the HALI. Complement system and its role in kidney disease. Various factors affecting GFR, advantage and disadvantages. T cell activation in renal transplant, and regarding the PRA. This question in the first paper is somewhat unexpected. Discuss the technique to assess the donor specific antibodies cross match in renal transplant. These are all the questions in the paper 1. Overall around 70% were expected one, around 30% were some the third paper or the second paper things are asked in the initial paper. So this is common in DM final exams. So going to the paper 2, starting from the question 1. This is regarding the contrast induced aka genetics, pathogenesis and clinical manifestation management of ADPCKD. Regarding the overture study, probably an unexpected question. Etiopathogenesis, features of IgA nephropathy, and also another very important recent advances in the management of IgA nephropathy. In most of the conferences, the discussion is about this IgA recent advances. ANCA vasculitis, another important question. Emphysematous pyelonephritis, peritoneal membrane structure, 3-pore model and the PET test. Vaccination in patients of dialysis, pre and post transplant. Here you have to be very particular with respect to the pre-transplant and with respect to the post-transplant also. The vaccination schedule, dosage have to be very particular, and it is a very important question for practical also. Immunological monitoring after kidney transplant, role of donor-specific antibody in renal transplantation. CMV prophylaxis, another important question. Chronic allograft nephropathy. These were the questions in paper 2. In paper 3, if you see the question, emerging role of clinical genetics in CKD. Therapeutic target of DKD, diabetic kidney disease, beyond SGLT2 inhibitor. This is also very important. There is a big tabular column given in Fayali, even in Brenner. And most of the conferences, if you go to the latest journal, there will be a big list of newer drugs. Green nephrology, another important Viva question. Where does bioimpedance spectroscopy play a role in the diagnosis of malnutrition in CKD? The nutrition in CKD itself is an important topic for the practical. So they have asked particularly regarding the bioimpedance. Advantages in understanding the role of allo recognition and spectrum of kidney transplant rejection. Newer drugs in AKI, and regarding again the biomarkers in predicting ADPCKD. This question probably bit difficult because they are asking for a specific urinary and serum biomarker in ADPCKD. TMA in pediatric patient. This one is somewhat recent question. How to manage hypertension in digital era. Some recent advances kind of question. Clinical advances in management of the glomerular disease. So there are few recent update related questions are here in this December 2023 Aims theory papers. That's all.